Hi there. My name is Inessa. I'm a software engineer from Minsk. For the last 3.5 years, I have been living and working in Prague, the Czech Republic. I have a son who was born with a kidney anomaly, and despite the fact that I have been a long-term resident and taxpayer in the Czech Republic, ensuring my kid has access to quality healthcare here has been, no joke, one of the biggest challenges of my life. So that's why I decided to come out and share one thing every foreign specialist from a country outside of the European Union should know, especially if they're considering relocating to the Czech Republic with their family. I will be point blank here because it can be literally be a matter of life and death. For the first 5 years of your work in the Czech Republic, your children won't have any option of a real health insurance, and thus their access to healthcare services will be extremely limited. Any serious illness or progression of a chronic condition has the potential to bankrupt your family. 26 countries of the European Union provide certain guarantees for foreign specialists from the third countries. As long as they are paying taxes, very dependent children are eligible for public health insurance. Generally, public health insurance for children is provided for free. Only two member countries require parents to pay minimum monthly premiums. Unfortunately, one country has never implemented such a regulation, and it is the Czech Republic. The Czech Health Insurance Act provides foreign residents from non-EU countries with two options on how to become eligible for public health insurance. The first one is obtain a permanent residence permit, which non-EU nationals can get after having spent at least 5 years in the country. Second option is through employment. And that's it. There is no exception for dependent children of employed foreign residents, as is in any other country of the European Union. And as children can't become employed, they are not eligible for public health insurance for up to 5 first years of their stay in the country. For those not eligible for public health insurance, there is a requirement to obtain private health insurance from a Czech provider. Czech private health insurance is a unique parallel concept invented for long-term residents only. Neither Czech citizens nor residents of the European Union use it. And the day a foreigner is eligible for public health insurance, he can't use his private health insurance any longer. Although in other countries of the European Union, when you hear the word private health insurance, you immediately imagine some extra services over the standard conditions and shorter waiting times. Don't get your expectations high in the Czech Republic. The Czech private health insurance offers you strictly a subset of services available through public health insurance. Private health insurance operates 100 times smaller network of doctors, which results in longer waiting times and bigger travel distances. But what's the worst of it is that a typical Czech private health insurance is not even a real healthcare plan. It is rendered non-functional by various imposed limits and numerous exclusions from coverage. From the 2nd of August 2021, private health insurance can be purchased from a single Czech provider only, private branch of VZP company Pojišťovna VZP. Their insurance for foreigners comes in two flavors. The first option, the VZP Plus plan. That is insurance for healthy people only, as it excludes coverage for any already existing health problems and has a tiny insufficient limit of 5,000 Czech crowns a year, that is basically less than 200 euro, on prescribed medication and medical assistance devices. The second option PVZP offers, the PVZP exclusive plan. This one should have been called Schrödinger's insurance, as a person with a pre-existing condition never knows if they will be able to afford it before actually relocating to the Czech Republic. Yeah, you got it right. A person with a pre-existing condition has no chance of getting a quota outside of the Czech Republic as the insurance company requires him to undergo a medical evaluation first. And only after you pay for it and submit the results to the health insurance company, PVZP will announce your individual price for the exclusive plan. One of those mandatory medical examinations, the general one, has to be carried out by a Czech specialist with a proper accreditation. This makes PVZP exclusive impossible to obtain prior to actual relocation. Now I have hopefully given you enough background information, and it's time to move on with the actual story. The story of my son and the daughter of my Brazilian colleague. Both of our children, before the relocation, were given the only option of a limited health insurance without pre-existing conditions coverage. The PVZP specialist assured us that after we moved to the Czech Republic, we can visit any PVZP branch and work something out. But after medical evaluation, PVZP informed us that the usual pricing on their website, around 30,000 Czech crowns at the time, could not be applied in our case. Our children were considered too risky clients for PVZP to take on. My son was offered coverage for 80,000 Czech crowns. My colleague had to pay 1,800,000 Czech crowns a year to cover his daughter. There is not even an option for monthly payments. We had to pay the whole sum in advance. Actually, that's another rule of Czech private health insurance, that you pay for several years upfront. It's no surprise that neither of us could afford it, so our children were stuck with the limited version of health insurance that didn't even work for them, and we had to cover all pre-existing condition-related costs out of pocket. Later on, I met other struggling parents whose children were first diagnosed with a serious condition during their stay in the Czech Republic. They shared more or less the same story. Suddenly, the child faints at school, the ambulance takes them to the nearest hospital, where doctors run some tests and discover type 1 diabetes. Private health insurance covers the cost of hospital stay, but when it comes to paying for insulin, it applies the special tiny limit on prescribed medication. 5,000 Czech crowns run out in the first couple of weeks, and after that, parents must pay for diabetes management out of pocket, as the private health insurance isn't paying anymore, neither for diagnostic strips, nor the insulin pump, or the glucose monitoring devices. The parents are on their own. This way or the other, the parents have to pay for certain healthcare services out of pocket as samoplátce. That is a Czech word that literally means a self-pay. But at the very first doctor appointment as samoplátce, parents will face another challenge. Once a healthcare provider finds out that the child comes from a country outside of the European Union and the parents are paying out of pocket, the price will dramatically increase. In the absence of any legal regulation, the majority of healthcare providers make absolutely no difference between a medical tourist who has specifically traveled to the Czech Republic to undergo a certain medical procedure and a long-term resident with limited private health insurance. Generally, we pay for outpatient care for our children 3 times more than the same procedure costs to any insurance provider. For the reasons mentioned above, the majority of parents had to delay treatment and stick to occasional trips to home countries as their only real option of escaping bankruptcy while providing their children with the health services they need. But 20 months ago, the world has faced a new challenge. The COVID-19 pandemic and subsequent travel restrictions have made our only option non-existent. And it was exactly COVID-19 that has sent our desperation over the edge. We could not go on like this anymore. That's why 20 months ago, me and other foreign specialists in the same boat decided to act. The very first thing we did was to try and find individual solution for our kids. We applied for permanent residence permit for our children under reasons worth special consideration. After 6 months of waiting, all applications were turned down. The second thing we tried was to escalate the problem to the European Union authorities. And at the beginning of this summer, I think in June 2021, I received a confirmation that our complaint has been considered admissible, and the European Commission is starting a formal investigation into the Czech practice of denying children of taxpayers public health insurance. That's, by no doubt, amazing news, actually great news, but let's be realistic here. The formal investigation and the following legal measures to be implemented could take years, so we had to pursue other options. As a software engineer, I couldn't help but make some calculations. And it turned out that every year, foreign specialists from the third countries who don't have their permanent residence permits yet contribute more than 3.3 billion Czech crowns to the public health insurance system through taxes. Less than 1.2 billion is later used to cover their own expenses, and nothing of the remaining 2.1 serves the needs of their children, who, by the way, would have needed less than 210 million annually. That's why we tried to initiate a change of the current law, asking to give foreign taxpayers a legal option to pay monthly premiums on behalf of their children. In September 2020, we created a petition and asked local political party, the Česká pirátská strana, for support. By the way, I want to thank you one more time, Česká pirátská strana, for not turning a blind eye to our problem. In March 2021, Česká pirátská strana presented a win-win solution. According to the law draft they had prepared, every child with a long-term residence permit would be eligible for public health insurance, with parents paying monthly premiums on their behalf at the same rate an unemployed adult Czech citizen is paying at the moment. Besides solving the 20 years ongoing discrimination, this, by all means, ingenious solution would have ensured greater stability of the public health insurance system as a whole by guaranteeing annual profits of more than 120 million Czech crowns. Unfortunately, there was a counter proposal as well. Another law draft was presented, this time prepared by the chair of PZP's board, who also happened to be a member of the major NU party. This proposal didn't address any of the core issues of the Czech private health insurance, but introduced a monopoly of a single Czech provider, private branch of PZP company Pojišťovna VZP. The suggestion was criticized by almost every state authority for contradiction with European Union's regulation and for obvious conflicts of interests. Yet at the final vote on the 13th of July 2021, it miraculously passed. Thanks to ANO, far-right SPD, the Communist Party, and Social Democrats, the fair win-win solution to the children's health insurance problem was discarded, and monopoly of PVZP was established instead. Unfortunately, that's not the end of the story, and more bad news is to come. 3 weeks after the final vote, PVZP started abusing its dominant position by excessively raising prices. The terms and conditions of their private health insurance plans didn't change at all. But for the first time, the insurance premiums for a very limited PVZP Plus plan substantially exceed real healthcare expenses of the public health insurance system in almost each and every age category. Blue represents the actual expenses of unlimited public health insurance. Red, the price of a limited PVZP Plus. For example, for a 5-year-old child whose average expenses in the public system are 11,200 Czech crowns, PVZP asks 31,400 Czech crowns for a plan that excludes any pre-existing condition coverage, has a tiny limit on prescribed medication, and what's crucial for children, doesn't cover important compulsory vaccination that is fully covered by public health insurance. Well, to sum up, I'd like to say that relocation is a unique experience and a great growth opportunity. But it is and it will always be a challenge, regardless of what your final destination is. However rewarding my relocation to the Czech Republic has been in terms of career and personal growth, no benefits can justify the desperation I feel every time I take my kids to the doctor. Unfortunately, current policy conveys message loud and clear. Children of third country specialists are second-class citizens in the Czech Republic, and people will turn blind eye to the violation of their basic rights, such as the right to health. I had to learn this sad truth the hard way because I didn't have this information before the relocation. But this doesn't mean you should do the same. Please consider yourself warned. Thank you for your attention. If you need to contact me, you have a bunch of ways to do that. And please take care. Bye.